So medical marijuana, this is pretty much the new hot trendy topic. It's been around for years and years. I recently started doing it this year. And I've done CBD and natural medicine, and I've treated pain forever, of course. But now that the political environment is a little bit more forgiving and accepting of medical marijuana, I feel more comfortable now offering it. But it is an awesome alternative for people with chronic pain, particularly if you don't want opioids, which are, in my opinion, way more devastating to people and have way more side effects and are way more costly in the long run. So I think for people that don't want to be on narcotics or want to reduce narcotic usage, this is an awesome alternative for pain management. So marijuana helps some people that have chronic insomnia as well, and that in turn treats pain. There's different ways to take marijuana. You don't have to smoke it. Smoking is still linked to cancer, and marijuana is just a different way to put carcinogens in, just like the tobacco leaf. So smoking's not the best way to do this. You can do it in tinctures, gummies, there's vaping, there's inhalers. All of these are highly regulated with medical marijuana, and you get exactly what you think you're gonna get when you take it. This is just an alternative, homegrown, US-made, plant-based therapies. It's an awesome alternative, I think. Most traditional chemical pain relief comes with negative side effects. So medical marijuana and CBD are in the world of natural medicine, which really there's almost no side effects. I'm not saying there aren't any because we're going to list a few, but it's just generally natural medicine is way safer than chemical, synthetic, factory-made medicine. I am no fan of narcotics. I think they're devastating to people and families, and that they do very little good except for short-term surgical relief. So I was thrilled when medical marijuana kind of hit the scene to give people an alternative for true chronic pain conditions. So why would a doctor recommend marijuana, you might ask yourself? Patient benefit with few side effects. Now, I will tell you this, you need to monitor people on marijuana, and you need to start very low dose and increase very slowly if you need to increase, and kind of keep an eye on the side effect profile. You obviously don't want someone going to a dispensary and just getting the highest dose amount and taking it all at once. So if you take it appropriately, it's few side effects. If you have chronic inflammation, true ongoing chronic non-malignant pain, meaning it's not caused by cancer, yes. If you have cancer pain, yes. So one of the best indications for this is chronic cancer pain. But there are a lot of reasons people have chronic ongoing pain, like the autoimmune disorders we talked about, fibromyalgia, diabetic neuropathy, and what have you. And then some people just have what we call in medicine intractable pain, meaning pain that no matter what you do, it never seems to go away or get better. And so medical marijuana is a good alternative for that group of people, because those people really don't have a good alternative. And a lot of people really don't want to take narcotics because of the heavy side effects on the brain and the rest of the body. So these are the qualifying conditions. Really, if you have intractable pain or any reason a physician thinks you need it. So let's say you have one of these endocannabinoid deficiency syndromes, you would probably be a great candidate for medical marijuana because it's natural. You don't have to take a lot of it. It's a great alternative to narcotics, and it doesn't have the side effects of the Neurantins, the Lyricas, the Celebrexes, the ibuprofens, and the narcotics that we're all aware of. So what do we use it for generally? In my practice, because I treat, I'm an orthopedic surgeon, but I also do a lot of wellness-based therapy. So my practice, it's a lot of diabetic neuropathy, people with fibromyalgia and myositis, like muscle-based pain, anything musculoskeletal, autoimmune disorders like rheumatoid arthritis, lupus, things like that. But look, there's a whole host of neurologic issues you can use it for, like MS, that causes a lot of pain because that's a chronic inflammatory disorder of the brain. PTSD, I'm a military veteran, and there's a lot of research going on for use of medical marijuana and CBD for PTSD. Parkinson's disease is a great indication for it. And then anxiety, high levels of anxiety. Even CBD has been shown to reduce anxiety. The side effects of medical marijuana are really a big deal in kids. So I personally don't think anybody with a developing brain should be taking medical marijuana unless they have a really solid indication for it, like epileptic seizures or something like that. And that's something you'd have to go see a physician about. But the brain develops up till age 25, and you can really cause major problems with the developing brain, particularly if someone's genetically prone to mental health disorders like schizophrenia or whatever. You can actually induce a psychotic break in a young person. So I think probably that's a group that should shy away from this. But depending on how much you're taking and your level of overall health and your hydration level, et cetera, You can cause dizziness. It's been known to increase the heart rate. It can cause low blood pressure, which in some people can be a problem. Now, in some people, that might help their high blood pressure. It can cause red or bloodshot eyes, and then mood changes, as we discussed. So there are some psychological issues that you need to think about. So if you're considering this for chronic neuropathic pain or whatever, really the key is to have a physician guiding you, go to a reputable pharmacy, which you really can't do anything other than that right now legally, and start with low dosing and just kind of titrate it to effect and avoid these side effects. In our state and in most places, to get medical marijuana, you have to be professionally evaluated by a physician. And then you receive your recommendation, and then you have to go to a certified pharmacy, which sells a regulated product. So it's actually a good thing because you know that you're getting a safe product that's been tested and it's not mixed with adulterants. It's not going to have like synthetic marijuana in it with all of those crazy side effects. So the medical professional, a physician like myself, will evaluate your condition, what meds you're on, your history of medications, your other treatments to treat the pain. Are you doing anything else? And hopefully guide you into other ways to empower yourself to get better. And it's really important to be honest when you have this visit with a physician, because otherwise we won't have any idea how to dose this. If you came to see me, I would meet with you, do an exam, talk with you, get your history. If I needed relevant medical records from somewhere else, we run your name through the database that tells us all of the narcotic and controlled substances you've received from any physician. And we have the ability to look at Louisiana and some of the surrounding states. And so I'll look at that and see what your current morphine daily equivalent is, and hopefully be able to help you modify that and reduce it if it's too high. And there's certain levels we look for and consider too high. And then once we go through all of that process and I decide that yes, so-and-so would be a great candidate for medical marijuana, then I make my recommendation. And it's pretty much that simple. I kind of say what I think the person should start with, and then I send it to the local pharmacy that's certified. Here in Baton Rouge, it's Capital Wellness. There's one in New Orleans, there's one in Shreveport, and I think there's one in Lafayette. And then they may have an appointment. So the pharmacist there will meet with the person that I've made a recommendation saying, yeah, I think this person might be a good candidate for this. And then they kind of talk to them too, and between the three of us come up with a workable plan for the therapy. And then we just do close follow-up. I mean, I don't think anybody should be left out in the woods with this with no guidance. So I try to see people every 2 months and make sure they're not having side effects. That they should keep a pain journal and a dosing journal, so we kind of can start to get a feel for what really does actually work for that person, for their condition, in their environment, with their diet, and et cetera, their metabolism. And then over time, hopefully we get optimized and get it just right for people.